kids.
Okay, you're live.
All right.
18 or 18. We are live, sir.
I think we're live. So do you want to do introductions or do you want me to do introductions? All right. Hi, my name is Stacy Brown. I am a physician at the Rural Health Clinic at Northern Indiana Hospital District's Rural Health Clinic here in Bishop, California. We're part of our Healthy Lifestyles talk tonight is going to be in celebration of Men's Health Month here in the Eastern Sierra in July. And I wanted to talk about vasectomies. So most of you guys are probably going to be live streaming at home instead of like sitting in my audience here, but that's okay. Also, this will be recorded so that we can take a look at it later at your own leisure. I'm going to kind of just jump right in. Tonight's presentation is really going to be some kind of like very high level kind of like overviews of vasectomies, but also just really getting into the kind of the nitty gritty of what the procedure is. Most guys that come to me to do a vasectomy are apprehensive. Like, what is it going to entail? How's it going to feel? What do I do afterwards? What do I do to prepare? So this is really going to be much more of a practical presentation on really the nuts and the bolts of doing the procedure. And this kind of follows from my consultation visits that I do in the office before we do the procedure. So that's going to be kind of mirroring what you would hear if you're coming to see me to get one of these things done. So I'm going to share my screen and we'll dive right in. All right. So again, that's me, that's us, that's what we're going to talk about. And so a little bit of a background. I have been doing the vasectomies here in town for about 25 years. I've probably done 1,200, maybe 1,300 in the years that I've been here. It seems like a lot of people for Bishop, but you know, that's what the demand was. I teach this procedure to students and residents, other doctors that have come to town. And I tell my patients when they come to see me, you've probably passed somebody on the street or at Vaughn's or Kmart or somewhere where I've probably done their procedure. So I think I have pretty good street cred. I've been doing this and people keep coming. So, but nuts and bolts. So it's kind of a tongue-in-cheek title for the presentation tonight. I ran across this from the Cub Scouts that made these little chess pieces out of nuts and bolts. But there's lots of gags in this one. There's actually a company that's out there that sells almonds and different nuts, and the actual company of the name is My Husband's Nuts. And somebody had a great idea that they would give away little bags of these nuts after their vasectomy. So there's a guy that does this procedure, I think in the Midwest somewhere, that says, you know, congratulations on your vasectomy. You know, you can have this little bag of nuts to take home. But in all the kidding aside, really, you know, you've kind of decided, if you've come to see me about vasectomies, you've kind of decided, hey, I'm done. Whether you have like a enormous family, like Mr. Smith here with his giant Mormon family, or you've decided, hey, I'm good. I don't need to procreate. Vasectomy is going to be one of those things that's considered permanent, kind of not reversible. And like, I've decided I don't want to have kids. This is not for somebody who's 18 or 20 that says, hey, you know, I think I just want to, you know, kind of get fixed for now. And if I decide to have kids later, then maybe I'll reverse it. Really, this is something that should be, I'm finished. And again, high level overview, method of permanent contraception. So we're not going to be trying to reverse this. Can you reverse it? Sure. It's a lot bigger expense. There's a 40 to 70% rate of getting it reversed successfully. And it's a lot more surgical work. So you really want to try to like make this a one and done thing and not have to think about reversing it. Super effective. Vasectomies are one of the highest effective contraceptions that are out there. I mean, like, 99.95% at preventing pregnancy. Very few other things are out there that has this level of success. If it's an office-based procedure, so it's locally done here in Bishop, in your doctor's office. You don't have to go to the operating room. You don't have to have general anesthesia. You just go to the office, do your consult, and then you have the procedure on another visit. It's covered by most insurances. Most insurances are going to be covering this completely. On the rare case that you don't have insurance, they're in California. If you reside in California, there's a program called Family Pact that deals with reproductive health, and vasectomies for guys is part of that. We think Family Pact program is something about reproductive health for women, whether it's covering an Nexplanon or IUD or something like that. But I've done a fair number of guys who didn't have coverage for whatever reason and got it 100% paid for by this Family Pact program. So cost should not be stopping us to offer this in town. I was blown away by the most recent statistic. There's 500,000 guys every year just in the United States to get this procedure done. That's a lot of guys. I mean, I'm doing my own share here at Bishop, but that's a lot of men in the US. So it's a fairly popular procedure to do. So what happens when you come in to, for instance, my office to get a consult? Usually it's going to be, a short visit. You're going to be, talking to the doc about it. You've come to the right place if this is your permanent sterilization that you want. And it's about education, just what I'm kind of talking about tonight. As a matter of fact, most of what I'm going to be talking tonight is what I go over with the guys for that 20-minute consultation visit. So education, which we'll do a little bit here in a minute. A little bit of history of the vasectomy. I'm not a whole bunch of history, but I'm kind of a history buff. So I think the first vasectomy was done in the mid-1800s and just kind of picked up worldwide now. There's actually a World Vasectomy Day worldwide too. A brief physical exam, making sure that all the parts are there that we think are there and there's none extras. And then doing some consent forms, getting your medications kind of prepared, getting you prepared for what's coming, including some medications, and then making actual procedural appointment for you. So again, I'm going to kind of dive into what I kind of usually do in my consult visits. So first is anatomy. All right. So basic anatomy, you've got male anatomy. This is cross section here. You've got testicles at the bottom. You've got a vas deferens. And so that's where the vasectomy word comes from. It's a vas, meaning from the vas deferens, and then ectomy, meaning we're taking a piece out. And that's really all we're doing is taking kind of a chunk out of the vas deferens so that the sperm can't go from the testicles up to the prostate gland, which is right at the base of the bladder here, and then out through the penis and ejaculation. There's nothing fancy here. It's just disconnecting the pipes, if you will. So we're going to do some whiteboard work here. So this is whiteboard time. Let me switch over to the whiteboard because I like to draw. I'm a drawer in the office. So stop hammer time. We're going to move to whiteboard time here in a minute. So give me a sec. All right. So again, kind of in anatomy, a shorthand, you've got kind of like, the scrotum that's in through here. You've got the two testicles on the bottom. And the testicles do a couple of different things, right? Testicles produce a hormone called testosterone. So we don't mess with that at all. That stays exactly the same, right? So libido is the same, hair growth is the same, muscle mass is the same. So testosterone checks out. We're not messing with that at all. But the testis also does a couple of things in addition to producing testosterone. And one of them is it produces these little sperms, right? So they're produced here in the factory. They get stored in a little backpack here called the epididymis. So they're hanging out here, kind of waiting for an ejaculation. And then during an ejaculation, it goes and follows up this tube called the vas deferens, kind of to the level of the prostate here, which sits right at the base of the bladder, right? And the prostate does a couple of different things to facilitate getting these guys to where they need to go. So one is that it adds a little bit of some extra volume to the ejaculate. So people are asking me, well, if I get the vas deferens cut down in through here, do I see anything? Am I like shooting blanks? No, you're not shooting blanks because the prostate adds volume It has proteins, it has extra fluid for the sperm to swim around in to try to find the egg, antibodies, all that kind of stuff. So you'll still have some contributions from the prostate gland until you have an ejaculation out the end of the penis. And I draw this picture for a couple of different reasons. One is it's just a basic plumbing diagram, but the next one is that you can see that when you come into the office to have the procedure done, and we end up taking the vasectomy kind of like offline here and taking a segment out of it, interrupting the flow, you've still got all these downstream guys that are hiding out on the prostate and everything else to kind of clear downstream. And it becomes really important post-operatively so that we can confirm that this is, a one and done thing. I'm finished, that I'm sterile. I'm not going to be moving those sperm out to be impregnating somebody. And if we disconnect this on day one, right here, this tube that goes up and through here, then you've got to clear out all these downstream guys. And it takes a while, right? So when you leave the office that day, it's not like, hey, I'm good to go. You have to clear out all the downstream guys first. And it takes a while. And a lot of people just kind of leave it up to chance, 3 weeks, or not 3 weeks, 3 months, and then I think we're good. But most guys that I have done the procedure on really want to know, am I done? Can I tell my spouse or my partner that she's done with contraception or not? How do I assure that that is the case? So I end up giving them a little specimen cup at the time that you go home, and in about 3 months, 2 to 3 months, kind of depending. So in about 2 to 3 months, we end up having you bring the specimen back to the lab at the hospital. And we see, are there any dudes in there or not? Any sperm? So you can imagine that that there may be one little Rambo hanging out here in the corner of the prostate, kind of waiting to take his turn in through there. And that one guy can ruin your day if you're expecting that you're going to be sterile. So we want to make sure that there are no sperm in the specimen before we let you go back to normal activity without any contraception. And statistics are somewhere around maybe the 2 month mark. You got about more or less 70% clearance at 2 months. So 3/4 of the guys will get a phone call from me or my MA that will say, hey, congratulations, your sperm specimen came back from the lab. There's no sperm in it. Have a nice life. Stop contraception. Let us know if you need anything else. Another maybe 20 to 25% will take another 2 months. So if you still have positivity here at the first 2 months, you'll need to kind of have another one done and see if you're positive there. So almost 90% of people will be cleared at the next interval, which would be 4 months out. And rarely do we have people, less than 10% of the population, that'll need that 6 month mark that are positive. And if you're positive past 3 different ones of these things, we need to kind of see what's going on. Did you kind of reconnect? Is there an extra pathway? I had one of those once where there was an extra third line, if you will. So we want to make sure that you are clear by the time we let you go about your business. So how do we do this? Right. So let's erase this and go back. All right, so procedure in detail here, right? How do we interrupt the flow of the vas deferens? So again, here's our drawing, right? Here's our 2 testicles. Got the epididymis, the scrotum, and the epididymis and the vas deferens that's coming up. So what we end up doing is when you come into the office, you end up having the standard kind of surgical prep. So we end up doing this very similar to any sort of surgical procedure we do in the office. So we want to try to decrease risks of infection, decrease risks of bleeding, decrease risks of pain. So we take all those steps as if we were taking your gallbladder out or your appendix out. So when you come into the office, put you on one of the exam room tables, we clean the area up with some surgical soap. So there's decrease your risk of infections. We're using obviously sterile instruments. And then we will, once it's clean, we drape it off with some clean towels, some sterile towels, and then we do an injection. So let me go back to my content here. So here you go. All right, here's our vas coming up. So we do an injection in the skin to numb up the skin. So there's 3 points to this one where you might feel something like localizable. And the first one is just a little pinprick or a mosquito bite of some local anesthetic going on the scrotal skin to kind of numb it up. And then we make an incision, honest to God, that's no bigger than about 1/4 inch that we can work through to kind of access the vas deferens. Again, we're going to try to decrease all these different risks to try to give you the best benefits that we want to. So one of the risks is, of course, infection. We just talked about decreasing that risk. The other one is bleeding. So we're going to, obviously make sure that everything is very controlled. Make sure that what we're doing is not going to create a lot of bleeding or bruising. And so after we get our little incision here, then we'll take a special tool and we'll kind of mobilize a loop of the vas deferens kind of out and into this, this space. So we can see what we're doing. A lot of guys have this misperception that, we anesthetize the whole scrotum, we make this big long saber scar, and then we fish around with a pair of tongs or something under direct visualization. No, we're working through a tiny, tiny little keyhole. And it's very much more comfortable this way, and it's very effective. So once we mobilize a loop so we can see what we're doing, I do 3 things to try to make this kind of a one and done, right? There are some techniques where you may slap a couple clips on there, little metal clips, and drop it back in. But you can imagine clips may fail, the metal may fatigue over time, they may migrate off of the area, and you just don't want to worry about that. So 3 things that I've was taught, and 3 things that I do to make sure this is a one and done deal is that we remove a 1/2 inch segment. So 1/2 inch segment comes out. Okay, it's hard to jump the gap, right? Evel Knievel across the snake river. Then we take 2 permanent sutures and we tie off each side. So here and here, just so we kind of blocks the flow either direction. And then on the free ends of the vas deferens and through here that are kind of exposed after we take the chunk out, we end up doing a little bit of some heat sealing, a little bit of some cautery. And those 3 things together really decrease your risk of failure, okay? Because again, you want this to work. And the best techniques are the ones that kind of have redundant systems. So the standard failure rate for vasectomies is roughly kind of like 1 in 100 to 1 in 200, which seems like a lot. In my experience with these 3 kinds of techniques, you can get your failure rate down to way under 1 in 1,000, which is where we want to be. So we're going to try to avoid failure rate by doing these 3 things. Once I'm happy with what I see, and there's no oozing or bruising or bleeding on that, because we're going to try to decrease the risk of bleeding, then I drop it back into this side. And then remember, you got another side over and through here you got to do too. So 99 times out of 100, we can go through the same little keyhole and reach over to this side and do the same kind of procedure. 1, 2, 3. Look for bleeding, make sure it's good, drop it back in. And then once we're happy with that, then we put 2 absorbable sutures kind of across the scrotal skin, and that will kind of hold it together until the stitches fall off. I use absorbable ones so that the stitches can fall off, and you don't have to come back and have me try to go find them. Usually the stitches will take 3 to 4 weeks to kind of fall off of the skin. Occasionally, if you're really good at manscaping, you can kind of let them last longer than that, but really they'll fall off on their own. Total operative time for the procedure is about 40 minutes, start to finish. So you can get it done in an afternoon. Generally, we end up doing the procedure at the end of the day, so no one's kind of rushing us afterwards. We don't have to kind of hurry up and try to see the next patient. Try to do these towards the end of the week so that people can kind of have a long weekend to recover. If we go back to the whiteboard here, talked about the risks. You saw those risks over here. Okay, so we got all 3 of those risks good. So benefits. Obviously, you can stop whatever contraception you guys are using right now. Okay, once we're all done with this. And again, all the benefits we talked about before, the cost and the local process that we do instead of the operating room. Now, what are the alternatives? Well, I mean, you can have your spouse or your partner go get a tubal ligation, right? Basically tying her tubes. But I mean, come on, guys. Tubal ligation is a big procedure. So for us, it is office-based. For her, operation. For us, it's a local anesthesia. For her, it's general anesthesia. For us, the follow-up is like 2 days of nothing over the weekend and maybe a week of light duty and we're good. For her, it's like 6 weeks of recovery. For us, it's probably sub $2,000. For them, it's like 10 with anesthetics and stuff. So they did their part. Now it's time for us to shine. So now we can do our part. So do it in the office. It's so much easier. That's really kind of the basics of the procedure. We'll go over kind of follow up in a second, but I'll tell you that over the years that I've taught this and that I've been doing this, they're kind of like 3 style points that I do. So 3 style points are, and it kind of follows from the anatomy. So I'm going to draw your anatomy over here on the side again here. All right. So the first one is, you can imagine that when you first stand up off of the exam table, when you're ready to leave and go, gravity is going to want to pull on these guys right where I did my work, right? So you don't want that. You don't want tension on that spot. So what do I want? I want anti-gravity, right? So I want some scrotal support. Now, no one knows what a jock strap is anymore, but scrotal support comes in a lot of different flavors. Compression shorts from baseball, swim trunks, Speedo, or old tighty whities, even a pair of boxer briefs if they have some good lift to them. But you can imagine boxers not a good idea by themselves just because they don't give you any lift. You don't want to be like a bell clapper in there bouncing around after I work on the vas deferens. And the scrotal support really needs to be on board for about 48 hours. Okay. And this is why if you are a working stiff going from 9 to 5 on a Monday through Friday, then we do you on a Friday afternoon at the end of the day. And then you have kind of the 48 hours over the weekend to kind of recover. Sure, you can take off your tighty whities to go take a shower or to pee or something, but you just wanted to kind of keep them high and quiet for those 48 hours. You want to wear them longer? Great. Second, for all the guys out there, if you've ever jumped into a cold shower or you've jumped into a cold lake, you know that there are muscles in the scrotum and there are muscles right next to each one of the testicles. So these guys try to go north to conserve heat. And those muscles are very, very powerful. So I don't want to have to fight those muscles for 40 minutes. And definitely you don't want me to fight those muscles for 40 minutes. It's much more comfortable for me. It's more comfortable for you. It's probably more comfortable for me too, because it's more efficient for me, but more comfortable for you and more efficient for me if we can make those muscles nice and pliable, nice and relaxed. One way to do that is to keep the temperature in the room kind of warm. So, you're comfortable, I'm kind of sweating my butt off, but it lets those testicles kind of like relax into the scrotum. The other thing though, is using a muscle relaxant. And this muscle relaxant really does a great job on all of these different muscle layers. And that muscle relaxant is usually in the Valium class, anywhere between 5 to 10 milligrams. And you take it 1 hour before the procedure is supposed to start. So if I'm doing you at 4 o'clock, you take it at 3. That way the muscles are all relaxed, the medicine's on board, and it gives us really good, flexible, pliable tissue to work with. If it looks like I'm going to give you a Valium an hour before your appointment, you're going to have a driver, right? So if you don't have a driver, I'm not doing it. But I don't want you to wrap the truck around a tree on the way home after you just got your vasectomy done. If you don't have a driver, I'm not doing it. And then the third and final thing, probably one of the most important things in post-op care, is 2 packages of frozen green peas in the freezer. Okay, not get them on your way home. I've got gobs of stories over the years of kind of classic fails from patients. The one with the frozen green peas was that I had finished my vasectomy and went by the local supermarket to get a few things on the way home. And who do I see in the frozen section but the guy I just did the vasectomy on? And he's still got some Valium on board. I'm assuming he had a ride somewhere to take him to the store. But he's like hanging out on the green peas aisle in the freezer section. And I'm like, all right, I'm not going to give him grief. I told him to get his green peas ahead of time, but I'm not going to give him grief. You just let him get his green peas. Went to the produce section, I come back, he's still there. It's like 5 minutes later and he's still there just kind of staring at all the green peas in the freezer. He's obviously still got Valium on board, guys, right? So he's not making good decisions. So I walked by and I said, let me choose for you. I got 2 bags of organic green peas, threw them in his cart and told him to go check out. Point is that you want to get those green peas in kind of a nest kind of like format, right? So you get home, you make a little divot in the middle, go and sit on the sofa. You got the scrotum that's kind of set in through here with your tidy whities on board. And you want to keep those areas kind of cold for about 20 minutes. 20 minutes on, okay? And then you're going to switch those green pea bags out. So change the bags in the freezer. All right, get a new one. And that takes you about 5 minutes. So it's off for about 5 minutes. And then you do it all again. Put the new bag on for 20 minutes. Change it, 5 minutes, let them warm up, back on for 20 minutes. And this whole cycle goes on for a total of 2 hours. All right. And this is really critical to kind of calm the area down. The cold creates less swelling, creates less bruising. Pain control is really good. It's just as if you sprained your ankle and you put the affected part on ice. 2 hours is good because if we put it on for total of 2 hours, the body's smarter than we are. So anything past about 20 minutes, the body thinks it's going to get frostbite, so it sends more blood to the area. Very typical for injuries. You put it on for a little bit, you take it off, and you keep putting it back on. So full 2 hours. Now the trick here is that most of us have, like little ones running around, and most of them want to watch a Disney or a Pixar film. So you just go and plop yourself on the sofa after this is done. You get your kids to ferry the peas back and forth out of the freezer, and then you grab whatever Pixar or Disney film for 2 hour runtime and you slap it in the DVD or stream it. So easy tip on that one to kind of get the timing right. Can you do it longer than 2 hours? Sure. But really the first couple of hours after the procedure is the critical part, right? That's where it's going to start the swelling. It's going to start any sort of bruising or discomfort. If you do all 3 of these style points, the scrotal support, keeping them high and tight, the muscle relaxant to kind of keep things nice and pliable and easy to do, and the frozen green peas, you're not going to need anything more than a Tylenol or a Motrin. I told you that there are 3 points during this procedure where there's localizable discomfort. The first one is the little anesthetic that you get. The second and the third one are when I grab the vas deferens, when I have a little specialized clamp to develop the loop. And really, it feels like a nut tap for about 2 seconds, right? So a little bit of some discomfort, but nothing that lasts very long at all. And the rest of it's just kind of like this vague kind of like discomfort that is generalized. Okay, so it's not like somebody's taken a baseball bat to your testicles. And most guys that leave the office after this is done remark that's like, wow, I didn't realize how easy that was. I got worked up about nothing. This was really much less tender than I originally thought. Follow-up. So how do we deal with this? We talked about immediate postoperative follow-up, right? So you've got your ice, you've got your green peas, which is the ice equivalent. You've got your Tylenol and your Motrin. You go home, you do that. Activity-wise is really kind of nothing. And I think I'm out of whiteboard here, so hold on. Let me go back to this one. I can pick up now here. Maybe. That and here. Okay, I think I've gone through style points. Show. There we go. All right, we talked about style points, right? Scrotal support, muscle relaxation, 2 packages of frozen green peas, post-op care. So really, you want to just kind of keep it quiet over the weekend. This is not the weekend to move your brother's garage. This is not lift refrigerators. This is not something to do a lot of heavy lifting, pushing and straining, because you want to keep that area quiet. So really 24 to 48 hours worth of no activity, which is, most of us kind of a long weekend, just be a slug. We talked about 48 hours worth of kind of keeping them high and tight, longer if you want to. You can shower the next day. The skin on the scrotum is pretty resilient, and so you don't need to keep it, moisture free. I would, however, say, like no immersions, no swimming, no hot tubs, no artesians, no canals, no river rafting for that week. Skin sutures we talked about, falls off in a couple of weeks. You don't need to go take those out. Tylenol or Motrin is really the only thing you ever need for this one. If you call me the next day and you say, I need like 5 Vicodin, there's something wrong. I need to take a look and see, what's happened. Again, no heavy lifting, pushing or straining for a week. What is heavy lifting or straining? Generally about 50 pounds for the average guy. Now, can you like lift a bag of pellets into the stove like once? Fine. But I don't want this to be a repeated kind of pressure on that system. Think of it as a hydraulic system. You don't want to like put too much pressure in there until it's nice and set. Ejaculation. So doc, I want to kind of clear out all the sperm so that I can kind of get a negative study at the 2-month marks. How do I do that? Well, it's not that you couldn't ejaculate, that night. It's just not going to feel real hot. So give it a week. So, no clearing out the sperm for about a week, then you can kind of pick up where you left off. Getting a specimen. We talked a little bit about like that little specimen jar that goes to the laboratory. So again, you got to be considering yourself firing live until that specimen is evaluated. All right. So you are, where'd it go? So there we go. Firing live. That's an Abrams tank, I think. And it may take several months to kind of confirm the sterility like we talked about, right? There is a natural attrition of the sperm just by time. Body absorbs these things. That's another question I get. What happens to the sperm after I tie off the supply end? You don't get like elephant, testicles in like 2 weeks because there's no place for them to go. The body is smart enough. It reabsorbs those and into the system, and you don't have to expel them. The body takes a little bit of some time to kind of get the hint that it needs to resorb all these guys. And it may take up to about a month for the body to get into full swing. Otherwise, you may feel just a little heavy. Average time for the sperm motility, the movement of the sperm to drop, is only 3 weeks. So if we do a specimen at the first month, we may see lots of sperm, but they're not moving real hot. It's because they've been kind of stranded out on the prostate and there's no new recruitments or new reinforcements coming. Average time for 0 sperm on there, for the body to absorb all that and to clear the pipes, about 10 weeks. So again, our 2-month, intervals are going to kind of bridge that. But again, if there's no moving sperm at the 12-week mark, you're probably sterile. But do you feel lucky, right? Do you really want to go there? Most guys are like, yeah, dude, I want to know. And my partner wants to know too, not just kind of wing it. So that's kind of vasectomies in a nutshell. This is super common in the US. It's super common in Bishop. I love doing these procedures. They're a lot of fun to teach. They're very gratifying for both the patient and the provider. So please consider that if it looks like you are kind of like done now, because I think it'll really work for you nicely. And if you have any other questions, you can always kind of contact me in the office. In preparing the lecture, I looked up vasectomy, and the first thing that cropped up was like Etsy, and I didn't realize how many t-shirts there are for vasectomies and post-vasectomy care. So here's a cluster of some of them too. The swim program has been cut, and then there's another one that says, but the coach is still alive. 100% juice, no seeds, right? Vasectomies prevent minivans. I love that one. That one's awesome. Again, I only shoot blanks. Vasectomy survivor, I kid you not, like kids, not, I get it, right? You get it there too. And I survived my vasectomy, and I didn't notice much of a vas deferens. Vast difference, yeah, anyway. May your surgeon have very steady hands. Mine are very steady. Good luck with your vasectomy. And again, if it looks like you guys are interested, we do these at the Rural Health Clinic at Northern Inyo Hospital District. Keep us posted if it looks like you want to do something. And that's about all I have for you guys. For whoever's online, chat wise, any questions, then send it on the chat. Otherwise, we'll wrap it up here. And remember that if it looks like your partner has missed this presentation, it is going to be recorded and will be available on the NIH website. Yeah. Okay. Thanks, guys.